Because of COVID-19, we have changed our visiting policy to not allowing most visitors. It was a very difficult decision to make, but it's a decision that was necessary to keep our patients safe.
It's just unbelievable to see the devastation that it's causing, and I think also as a nurse, besides the chaos that's in the hospital and what we need to do, to see the patients without their families here, to know that they're alone.
That's an inside look inside the intensive care unit at Maimonides Medical Center in Brooklyn. The Washington Post was granted exclusive access to tell the story of what is happening in a New York City hospital as the coronavirus continues to spread. 80% of that hospital's 600 adult patients, they have COVID, and they're worried that they will run out of beds. I want to bring in the Post reporter who covered the story, Lenny Bernstein. He covers health and medicine for the paper. Lenny, thank you for joining us. And why did the hospital explain to you that usually, medical professionals, they're loath to let a reporter inside their doors, but they chose to make an exception? What was the reason they gave you?
Well, John Gerberg and I, the videographer, had worked a story up there a year ago, the measles outbreak. So they knew us a little bit, and they were comfortable with us. More importantly, I think for them was to show people that despite how difficult things are right now, that despite how bad it was getting, that care is being given, that nurses are helping patients, that while most people die, some people get better, and that people could have a sense of what goes on inside so that they could have some confidence in case they or a loved one ended up in there.
We've had the opportunity to speak to a lot of ICU docs on the front lines, and we've heard all different stories that you really encompassed in your piece as well. And I'm curious, from the staff that you came across, the RNs and the docs, is the exhaustion that they're dealing with, do you think it's more on just the back-breaking, unending, seemingly shifts they're dealing with, or is it just the unending sense of loss that they have to encounter day after day?
I think it's the exhaustion of physical work. I think it's the stress of what they're going through. I think it's the losses that they're seeing. I think it's taking care of patients whose families aren't around. This is a whole new thing for them. Everything has changed. For the nurses, what's really changed is that the families aren't there. Social support, family support is actually a critical element in care of people getting better. And now the nurses, in addition to working longer and harder and under more dangerous conditions, they're subbing in as sort of proxy family so that these patients aren't completely alone, even if they're unconscious. So, for example, we featured one woman who sings and talks to her patients because she believes they can hear her, and she wants them to know that they're not alone.
And you also say that if the shift ends, she then has to pick up the phone and talk to the families who are looking for any kind of shred of hope. But that brings me to the unfortunate reality we're learning about, which is, I think to the general public, Laney, they hear the word ventilator and they believe, rightfully so, that it is this miracle piece of equipment. But the belief I think most people have is it leads to happy endings where people walk out of the hospital because of that life-saving device. The numbers we're hearing, the governor said it himself, 80% of the people that got on it never get off, and so many of them are on for weeks at a time. Is that the reality that you've come across in covering this?
Absolutely. The data show this. The governor said it himself. The data out of China and Italy support this. I think it's a little bit lower. In our tour of those two ICUs, it was made very plain to us that if you get up to that floor and you are ventilated, intubated, most likely you will die. Very few people come off of those ventilators and then go back down to a less intensive care floor and then go on home. And as you mentioned, a very, very astute point is that people are lingering on these ventilators much longer than under normal circumstances 2 weeks, 3 weeks, even more than that, which is why these machines are so coveted. If California lends 1,000 ventilators to New York, they don't know that they're getting them back before they need them, because there may still be 900 New Yorkers still using them. So it makes planning for this pandemic ever more difficult, because you have to factor that in as well.
And just to that point, I know people hear a flattening of the curve or that we've plateaued or whatever else, and I am so worried that people are going to misread that somehow we're on the other side of this. They're still worried, aren't they, that PPE is going to run out, that the patient demand and the ability to really care for them, and the governor used the expression today, redlining. These people have been going so hard, these medical professionals in the front lines. At some point here, they got to get the cavalry to come, that we're not remotely through this, right?
Think about a graph. We're reaching the peak now, but it's not just going to drop off a cliff and go straight down. It's going to come down gradually. And especially with people having been cooped up now for, a month and a half, there's going to be this real desire to get out there, get back to work, get back to our lives. The president talks about it all the time. It's not going to work that way. We have to gradually slow this thing down without losing our social distancing discipline, without running out there to celebrate, and just bring it down slowly. One of the things that might do for us is, if there is a second wave in the late summer, early fall, we might be able to tamp that down as well. So don't anyone expect we're all going to just yell all clear and we're all going to come bursting out of our homes. It's not going to happen. We need to slow it down gradually.
Lenny Bernstein, great reporting. And again, I appreciate the time today. Thank you.
You bet. Thanks for having me.
All right, everyone, when we come back, despite the pandemic, unbelievably, today was Election Day in Wisconsin, and people lining up as we speak to vote. After the break, we'll explain why one political party decided to mandate here that people couldn't vote via mail but had to in person.